Hello, this is Dr. Lilly with Enhanced Chiropractic Relief. Today we're going to be talking about causes of non-specific low back pain, what we can do about it, things that you can do at home to help relieve some of that pain. We're going to start with just an overview of what non-specific low back pain is. So essentially what it is it's characterized as any type of back pain, or in this case lower back pain, that doesn't have a primary pain generator. So for example, the facet joints in the lower back can cause pain if they're irritated, inflamed, or if there's an injury to the facet joints. In that case, that would be a facet joint related pain, and that would not be classified as non-specific lower back pain. There's also disc injuries in the lower back, such as like a herniated disc or a radiculopathy, where you kind of have like that sciatica type pain. All these are clinically relevant in terms of diagnoses that are causing your lower back pain. We're not talking about those. What we're talking about is specific pains where if we look at your MRIs, we look at your x-rays, we do all these orthopedic testing, and we're not really pinpointing a specific structure that is causing the pain. So in terms of that is primarily what we're focusing on in terms of this video, and that is what we would regard as non-specific lower back pain. Now, another thing that I want to address in terms of non-specific lower back pain, again, kind of this niche topic in terms of lower back pain, which is a wide array of injuries that are associated with lower back pain, is the biopsychosocial model that we follow. So bio meaning biology, that's our anatomical structure, again, kind of more referring to the joints, the discs, the ligaments, muscles, all things of that nature that can cause pain, as well as the psychological aspect, meaning that the way that we view the world, the way, how confident we are, our self-esteem, if we're undergoing any type of anxiety or depression, all of those things psychologically can have an impact on non-specific lower back pain. So that some of the times it's not actual injury to the tissues as much as it is psychologically related, and that's not to say that it's the pain is in your head, you're kind of making it up. That's not what I'm saying. What I'm saying more specifically is that certain emotional states such as depression can actually cause fatigue, can actually cause lower back pain in some instances. So in that case, it would be good to consult some sort of therapist or psychologist to kind of help deal with some of these issues. So ultimately what I want to say is do not exclude the psychological aspect of pain and emotional states that can alter that. So that's very important to keep in mind. When it comes to this specific topic, the research is a little nuanced because, again, if we don't really know what's exactly causing your pain, it's going to be a lot harder to try to address this issue. For example, if we had a disc injury or if we had a facet injury, those are all things a chiropractor can do wonders for, whether that's distraction, opening up those joint spaces, the adjustments that can help with the disc injuries, that can help with the facet joint injuries, things like that. However, with non-specific lower back pain, the research is pretty difficult to understand because we don't know what's causing it. If we don't know what's causing it, how are we going to apply a specific solution to that? So that's one thing. However, there are options that we can do, and a lot of that has to do with just general exercise, general fitness, general well-being in terms of health, in terms of exercise and nutrition. These are all things that we can help and alter and maybe even change per person. It's dependent per person that can actually help with these non-specific lower back pain cases. So in cases with non-specific lower back pain, there's three things we want to focus on in terms of overall wellness. So our general fitness, our mobility, and our stability. So we're going to focus on the first thing, which is mobility. So generally mobility can be defined a few different ways, but the way I define it is how we can move our body in specific ranges of motion in a safe manner. Okay, so if you have limited mobility, then that means you're not going to be able to move through a maximum range of motion in a safe manner. And typically that comes in the form of tightness. So for example, if you were to kind of rotate through your mid-back here and it feels really tight, typically that's an indicator of you being stiff, and those muscles are generally going to be very tight, and that's more of a protective mechanism, because if you were to push through that range of motion, your body's not used to that range of motion, so it might think it's kind of like in a danger zone type of sense. So your body naturally starts to kind of spasm and seize up and hold on to those muscles because it's not used to being in that range of motion. So ideally, if we want to increase our mobility, there's a couple ways we can do that. Number one is adjustments. So getting a chiropractic adjustment, this specifically is for the joints of, in this case, the spine. Or the adjustments are going to be very good in increasing range of motion. The best thing we can do after that is load it with exercises. So once we get those tissues to kind of release, get those joints to move in an appropriate range of motion, now our job is to neurologically improve upon that, so our body now has access to this range of motion, and we're able to activate that range of motion through through movement, essentially. There's one other thing that also plays a part into that, which is our soft tissue extensibility, which means that the way our muscles kind of play into the movement aspect, right? So it's one thing that if the joints can move, but the thing that moves joints is muscles. So in some instances, if we're feeling really tight and our muscles are usually really spasmed or have an increased tone, that's generally because they've been locked in a certain place for so long. Think about like when you're sitting for long periods of time and like the front of your hips, your hip flexors get really tight. It's the same idea. Those muscles are stuck in a certain position, and it might take some time to fully kind of stretch it out before we're able to achieve proper hip range of motion. It's the same idea with the lower back muscles. Most people with non-specific lower back pain have some form of decreased mobility, meaning they're lacking some sort of movement, and that may or may not be the reason for their lower back pain. Now, to add on to that, if you have proper hip mobility, generally your lower back will be a little bit less stressed versus someone who has very tight hips. So if you're someone who sits for long periods of time, let's say you're a desk worker, you're sitting down a lot, just typing away or things like that, your muscles are going to be shortened in a specific way that might actually inhibit your hips and thus your lower back. Right? If your hips are not able to move, let's say in a squat, and they're not able to flex, then your lower back's going to have to compensate to achieve that motion. That's just one example of how limited mobility can potentially cause lower back pain, because you're causing increased stress on certain areas that are not supposed to be tolerating that stress, or may be tolerating that stress too much, and those muscles are not equipped to handle that stress, thus causing pain. So in terms of mobility in the low back, the best things that we can do is actually hip mobility exercises, as well as possible mobility exercises in the lower back. Another thing in terms of mobility is the lower back itself. Now, with non-specific lower back pain, like I said, a lot of people who have limited mobility have been shown to have increased non-specific lower back pain. So the best thing you can do for that is get adjusted, is get soft tissue work, as well as at-home stretching and at-home exercise, specifically for the lower back. Now, there's a certain method that you can do, which is you start with some soft tissue work, whether it's a massage or whether it's some sort of muscle work from a chiropractor or a PT or someone who works on those sort of things. After that, ideally getting adjusted, because now with the muscle work, you're working on the muscles. With the adjustment, you're actually working more primarily with the joints. Now, once we kind of free up the restrictions in the joints and allow greater movement through the muscles, that's when we add on these specific exercises to further enhance that. So that was primarily dealing with mobility. Now we're going to move more towards stability, which is the opposite of that. So typically with mobility, we want to increase range of motion. We want to increase how far we can move and that range in which we can comfortably and safely move in. Stability, in some sense, is actually the opposite of that, where we're trying to hold everything together. We're trying to keep it nice and strong and almost restrict movement. And this is where it gets tricky with each particular person, because someone might be naturally more mobile and they might need more stability, whereas someone who might be more stiff might need more mobility to increase or at least help with their issues in terms of non-specific lower back pain. So in terms of stability, we want to focus primarily on the core exercises as well as the hips in terms of non-specific lower back pain. So like I said, typically in the hips, if those aren't mobile enough, then the lower back has to compensate. And typically when there's too much motion in the lower back, that generally, for the most part, not every time, but for the most part, is problematic. Because if there's too much motion in that lower back, that's going to cause a lot of stress on our pelvis and our lumbar joints, and sometimes the discs as a result. Typically, we want to increase stability or enhance stability so our lower back can be nice and stable and our hips can move freely. Ideally, that's where we want to be. So in terms of increasing stability of our lower back, there's a few things that you want to focus on in terms of exercise. In terms of general pain relief for the lower back, again, getting some soft tissue work done, whether by a massage therapist, PT, or a chiro, getting adjustments, because that has been shown to decrease pain first and foremost and allow you to move in ranges of motion that you haven't been able to before. But once we're able to do that, we also want to strengthen those muscles, especially the muscles of the core, to increase our resilience to prevent injury, because typically a lot of times with injuries, especially in the lower back, it can be due to muscle fatigue. If those muscles are fatigued and they give out, you lose that stability in that spine, and that can lead to injuries, whether it's overuse injuries, whether it's a disc injury or some sort of ligament injury. It more than likely might have to do with some sort of fatigue aspect of our muscles. So in terms of the core, we want to increase endurance and strength of those tissues to be a little bit more resilient. And that pretty much encompasses the stability aspect of our lower back, which may help with your non-specific lower back pain. Now, talking about specific exercises we can do for the lower back to increase stability, you want to focus primarily on stabilization in terms of isometric holds. Now, isometric holds are very important because you're essentially tensioning the muscle, you're activating the muscle, you're getting it to contract without any ranges of motion being involved. So this is really good for beginners or even people dealing with pain and they have issues with squatting or have issues with deadlifting or things like that, where you're trying to stabilize the core through movement. With isometric exercises, you're actually increasing strength without that movement. So it's a kind of a beginner's approach to it, which is usually what I start with most of my patients anyways, because they're coming to me with lower back complaints and low back pain. We want to start from the ground up, build that foundation of strength and endurance in the tissues in a safe manner, and then we can improve upon performing the deadlift, performing the squat, or specific exercises that they had trouble with in the past, and see if there's any other things that need to be addressed, such as like ankle mobility, hip mobility, thoracic extension, things like that. That's a little outside the scope of this video, but in terms of just general core stability, we want to focus primarily on isometric holds. Now, a few exercises that primarily work on those isometric holds are things that we all pretty much know how to do already, although maybe not the best, but we have an idea of what to do, such as planks, side planks, bird dogs, dead bugs, glute bridges. 5 really great exercises to improve core strength and endurance without any real movement, because you're just holding that position for a set amount of time. And that's usually the beginner's just basic isometric exercise that is usually good for most people. If you are experiencing pain with certain exercises like this, there are modifications to it, as well as having someone to look over your form and make sure you're doing it right. For example, in the plank, when people perform the plank and they fatigue really quickly, they tend to arch their lower back and dip their hips down towards the floor, and this puts actually a lot of stress on that lower back. So typically when people have lower back pain when they're planking, it's usually because they fatigue in the muscles and they're trying to hold it and they're compensating. And the way that they compensate is by dipping their hips, and that puts a lot of stress on the lower back, unfortunately. So it's not that it's twofold. It's that those muscles fatigue really early, which means that they might need to regress to build up that tolerance, and then also that they need to work on their form. So to conclude everything and to sum up everything, there's 2 primary things we want to focus on in terms of people with non-specific lower back pain, and that is mobility and stability. So mobility of the hips is generally a lot more important than mobility in the lower back. Stability in the lower back and in the core is generally a little bit better than stability in the hips, although we need both in both areas, but at a different ratio. So generally we want more mobility in the hips and a little bit less stability, although it's still there, and then reversed in terms of lower back, right? And generally it depends person to person. Again, if you have a bodybuilder or like a power lifter, most of the time they're going to be a lot more stiff and a lot more stable. Where someone like them, they might need more mobility, and those are some things that we might work on with that patient or that person. We're working primarily just on mobility things, right? And on the flip side of that, if someone is more mobile, let's say like a ballet dancer, where they're very flexible, very mobile, they can get in really contorted positions very easily, but they have lower back pain. In that case, we might want to focus a little bit more on stability and giving them, more stabilization exercises, and maybe even progressing them to more strength training, resistance training to stiffen them up a little bit, and that might help them with their non-specific low back pain. So it really depends on what, I guess, category you fall into, and things that we can work on in terms of compensations, in terms of form, in terms of overall endurance and strength of your tissues. There's a lot of things we can work on, but it really depends on each person. This is primarily just a video to get you to think about you specifically and what you might be lacking in terms of mobility and or stability. And if you don't have any clue about that in terms of yourself, please make an appointment. We can talk about it. We can discuss it. We can go through some ranges of motion. We can go through all these tests and see what's causing your lower back pain. And then we can put together a plan and help with that. Okay? Again, this is Dr. Lilly with Enhanced Chiropractic Relief. Hope you enjoyed the video. Like, subscribe. See you next time.